Welcome to this deep dive. We are going to be looking at the world of community health, and specifically, we're going to be using a public health nursing textbook as our guide.
Okay.
Now, you might be thinking,
Sounds interesting.
what does nursing have to do with me?
Right.
But trust me, this information is relevant to everyone, especially when we start thinking about how our communities shape our health.
That's right. We often think about health as this very personal journey.
Yeah.
But this deep dive is really going to, I think, reveal some of the influence that the community has that's often overlooked.
Yeah.
It's like realizing you're part of a bigger ecosystem.
Right. Okay. Let's jump right in.
Okay.
So the source material kind of starts by highlighting these two distinct perspectives on community health.
Mm-hmm.
The first one kind of views the community as this powerful force that shapes individual behaviors.
Yeah, and it's interesting. This perspective, I think, really highlights the role of social norms and environmental factors in influencing individual health.
Yeah.
So for example, think about the impact of public smoking bans.
Okay.
They weren't just about protecting non-smokers. It was also about shifting the social norms to make quitting easier and discourage new smokers.
Oh, so it's like the community kind of sets the stage,
Yeah.
making certain choices easier or harder.
Exactly. It really challenged that whole idea that, health is just a matter of personal responsibility.
Yeah.
The community provides a context that can either support or hinder healthy choices.
Right. And that leads us to the second perspective, which views the community as a complex system that needs to be healthy as a whole.
Yeah, this is where things get really interesting.
Okay.
It's about looking beyond just, the individual issues that are happening and focusing on how do we strengthen the community's overall capacity to thrive.
Okay.
It's like recognizing that a healthy community is more than just the sum of its parts.
So it's not just about fixing problems, but about empowering communities to actually solve problems and create a healthier future for themselves.
Exactly. And to do that effectively,
Uh-huh.
we need to really understand what's already happening within the community.
Right.
And that's where community assessment comes in.
Okay, the textbook actually compares it to taking the community's pulse.
Yeah.
What does that actually involve?
So it's a systematic process of gathering information
Okay.
to understand the community's strengths, its weaknesses, its needs, its aspirations.
So it's about getting this holistic picture,
Totally.
not just focusing on the negative.
It's not just about what's wrong.
Right.
It's about understanding the whole.
It's like conducting a thorough health checkup for the entire community.
Exactly. And just like a doctor uses various tools and tests, right?
Yeah.
Community assessment relies on different types of data
Uh-huh.
to get a really complete picture.
Okay.
And one important source of information is what we call secondary data. So that's existing information that's already been collected.
So things like census data, health statistics, policy documents?
Exactly.
That sounds like a treasure trove of information.
Oh, it is.
Wow.
It is. And it can really save us a lot of time and effort.
Yeah.
Instead of starting from scratch, we can build on what's already known about the community.
That makes sense. But I'm thinking looking at all those numbers and reports can be kind of overwhelming.
Oh, yeah.
How do we even begin to make sense of all of it?
That's where understanding some key health statistics is really crucial.
Okay.
For example, prevalence and incidence rates.
Okay.
Those can really help us grasp the extent and spread of different health issues within a community.
Oh, those terms always kind of trip me up.
Sure.
Can you remind me of what the difference is?
Of course.
Yeah.
So prevalence is like a snapshot.
Okay.
It tells us how many people in a community have a specific health condition
Okay.
at a particular point in time. So think of it as the overall burden of a disease in a population.
Okay, so it's like a static picture of the situation.
Right.
What about incidence?
Incidence is more like a video.
Okay.
It measures the rate of new cases of a disease
Got it.
over a specific period of time.
Okay.
So it helps us track trends,
Uh-huh.
see if a health problem is increasing or decreasing.
So prevalence shows us the big picture while incidence reveals how the situation's changing over time.
Exactly.
Okay.
And then we have
Uh-huh.
morbidity, which focuses on the impact of illness,
Okay.
and mortality, which examines death rates and causes.
Right. And that's it's a reminder that these aren't just numbers.
Right.
They represent real people's lives and experiences.
Absolutely. These statistics reveal, the health challenges
Yeah.
and opportunities within a community, and they can help us identify areas where we really need to focus our attention.
But here's where it gets even more intriguing.
Okay, tell me more.
What's the next layer of this community health puzzle?
Well, it's not enough to just look at these numbers,
Right.
We have to actually delve deeper into those underlying factors that contribute to these health trends.
That's it.
And that's where the concept of social determinants of health comes in.
This is one of those like aha concepts
Yeah.
that really changes how we view health, right?
Absolutely.
Right.
It's about recognizing that our health is influenced by much more than just our genes and, individual choices. Things like poverty, education, social connections, even the environment we live in all play a significant role.
The textbook actually mentions a surprising example.
Yeah.
The link between social isolation and chronic diseases.
Wow.
I never really thought of that as a health risk.
It's a powerful illustration of how interconnected our lives really are,
Yeah.
Social isolation can lead to stress, depression, and unhealthy behaviors,
Right.
all of which can contribute to a higher risk of chronic illness.
So it's like a domino effect.
It is.
Yeah.
And so understanding these social determinants is absolutely crucial for addressing those health disparities and creating more equitable communities.
Okay, so this is all incredibly fascinating.
Yeah,
But it also seems like a really complex web of interconnected factors.
it is.
Where do we even begin to unravel it all?
Well, one key takeaway from the textbook is the importance of teamwork.
Okay.
Community health nursing really emphasizes collaboration,
Yeah.
not just within the healthcare system, but across different sectors of the community.
So it's about bringing together diverse perspectives and expertise
Exactly.
to tackle these complex issues.
Yeah, we need to break down those silos
Right.
and work together to create solutions that address the root causes of these health challenges.
Okay, so this deep dive is already shedding new light on how we view health and communities.
It is.
I'm eager to see where it takes us next.
Me too. In the next part of our deep dive, we'll explore how communities can actually take action to improve their health,
Okay.
using this concept of community assessment as our roadmap.
Yeah.
Okay, so we've established that understanding the community's unique context is crucial for addressing its health challenges.
Yeah.
And the textbook really dives into this idea of community assessment as a way to gain that understanding.
It really does. It's like putting together this giant jigsaw puzzle
Okay.
where each piece of data we gather, from census reports to local health surveys, really helps us create this clearer picture of the community's overall health and well-being.
It sounds like a pretty comprehensive process.
It is.
Where do we even begin with this community assessment?
Well, the textbook kind of breaks down the process into these 6 key steps.
Okay.
Starting with reviewing sociodemographic data.
Okay.
Think of it as like creating this detailed portrait of the community, capturing everything from age and gender distribution to occupation and income levels.
So we're essentially getting a snapshot of who lives in the community and what their lives are like. Yeah. Exactly. This information helps us understand the community's makeup and identify potential vulnerabilities or disparities.
Right.
For instance, a community with a large elderly population might have different health needs
Right.
compared to a community with a lot of young families.
It's like understanding the unique fingerprint of each community.
Precisely. And once we have that basic understanding, we move on to step 2,
Okay.
reviewing epidemiological data on health status.
Okay.
This is where we kind of dive into those prevalence and incidence rates we talked about earlier,
Right.
along with morbidity and mortality data.
So we're looking at the actual health issues that are affecting the community.
Exactly.
Are there any surprising trends that have emerged from this kind of analysis?
Oh, you'd be amazed at the insights we can gain from looking at this data.
Okay.
For example, in some communities, we might see a higher than expected incidence of certain cancers,
Wow.
which could point to environmental factors or lifestyle choices that need further investigation.
It sounds like this data can really guide our actions and help us prioritize where to focus our efforts.
Absolutely. And the beauty of community assessment is that it doesn't just stop there.
Okay.
In step 3, we actually go beyond the numbers
Okay.
and we tap into the knowledge that's already out there
Okay.
by reviewing previously conducted community surveys and program statistics.
So we're learning from what's already been done in the community.
Exactly. These past efforts can provide valuable insights into the community's perceptions of their own health, the effectiveness of previous interventions,
Okay.
and areas where there might be unmet needs.
It's like tapping into the community's collective memory and wisdom.
It is.
I'm starting to see how this assessment is more than just collecting data. It's about understanding the story of the community.
You're exactly right. And that story also includes the policies and regulations that shape the community's health.
Okay.
So in step 4, we delve into those policy documents,
Okay.
both at the national and local levels, to understand the broader context in which the community operates.
So we're looking at things like healthcare access, environmental regulations, social programs.
Precisely, these policies can have a profound impact on health outcomes.
Yeah.
For instance, a community with limited access to affordable housing might experience higher rates of homelessness,
Right.
which in turn can lead to a whole host of health problems.
It's another reminder that health is not just about individual choices, but about the systems and structures that surround us.
Absolutely. And in step 5, we take a deep dive into the research.
Okay.
We review the relevant scientific literature on the specific health issues that we're examining.
Okay.
This helps us stay up to date on the latest evidence and best practices.
It's like bringing in the expertise of researchers and academics to inform our understanding of the problem.
Exactly. It's about combining local knowledge with scientific evidence to develop the most effective solutions.
Okay.
But gathering all this information is only part of the process.
Right.
The final and really crucial step, step 6, is all about synthesis.
So this is where we make sense of all those puzzle pieces we've been collecting.
Precisely. We take all that data, the demographics, the health statistics, the policy analysis, the research findings, and we weave it all together into this cohesive narrative that tells the story of the community's health.
Okay.
We identify patterns, highlight key challenges and opportunities, and ultimately create a roadmap for action.
It sounds like we're not just presenting a list of facts, but we're creating this compelling story that can inspire change.
That's the goal. We want to present a clear and concise overview that resonates with community members, policymakers, and other stakeholders.
Okay.
It's about turning data into actionable insights.
So it's about taking all that we've learned from this deep dive and turning it into a force for positive change in our communities.
Exactly. And the next part of our exploration will delve deeper into how those changes can be implemented by examining different perspectives on community health and the strategies they offer.
Okay, so we've gathered all this information about the community, through assessment.
Right.
Now the question is, how do we actually use it
Yeah.
to make a difference?
Exactly.
The textbook talks about these different perspectives on community health,
Yeah.
which I'm guessing will help us answer that question.
They do. They really provide frameworks for thinking about how to approach community health improvement.
Okay.
And one perspective sees the community as a social setting that shapes individual and group behavior.
So it's acknowledging that our environment and the people around us have a huge influence on our choices.
Exactly. This perspective really highlights the power of social norms.
Okay.
And how they can either support or hinder healthy behaviors.
Okay.
So for instance, if healthy eating is considered the norm in a community, individuals are more likely to adopt those habits.
Right. It reminds me of how some communities have successfully reduced smoking rates by changing social norms. It's not just about willpower.
Right.
It's about creating an environment that supports those healthy choices.
Exactly. The textbook even uses this phrase, the healthy choice becomes the easy choice.
Yeah.
Which I think is a great way to kind of summarize this perspective.
Yeah, I like that.
And then there's another approach that views the community as a client.
Okay, this one sounds intriguing.
Yeah.
What does it mean to see the community as a client?
So it's kind of a shift in focus from individuals to the community as a whole.
Okay.
It's about recognizing the interconnectedness of all these different systems within the community and how they all contribute to overall well-being.
So it's like treating the entire community as one big patient.
In a way, yes.
Right.
It's about taking this holistic approach to health, considering factors like access to health care, education, economic opportunities, the physical environment.
Right. And the textbook also emphasizes the importance of community participation in this process.
Oh, absolutely. Engaging the community is crucial.
Yeah.
It's about empowering residents to identify their own needs and priorities and to be active partners in developing those solutions.
That makes so much sense instead of imposing solutions from the outside.
Right.
We need to tap into the community's own wisdom and resources.
Exactly. When community members are involved in the process, they're more likely to feel ownership and take pride in those outcomes.
Right. So how can someone listening to this deep dive take action and actually apply these ideas in their own community?
Well, I think it starts with awareness.
Okay.
Pay attention to the social and physical environment around you.
Mm-hmm.
What factors might be contributing to health challenges in your community?
Right.
Are there opportunities for improvement?
So just like being more observant and asking questions can be like that first step.
Absolutely. And then think about how you can get involved. Attend community meetings, connect with local organizations, volunteer your time, or even just start conversations with your neighbors about these issues.
It sounds like small actions can make a big difference when we're talking about community health.
That's right. The textbook really highlights the power of collective action.
Mm-hmm.
When people come together with a shared purpose, they can achieve amazing things.
This deep dive has given me like a whole new perspective on community health.
Good. I'm glad.
It's not just about individual choices or healthcare systems.
Right.
It's about understanding this complex web of factors that influence well-being.
Yeah.
And working together to create healthier communities.
Absolutely. And it's not about having all the answers.
Right.
It's about embracing the learning process.
Okay.
By staying curious.
Yeah.
Engaging with our communities and being open to new ideas, we can all contribute to building a healthier future.
So as you go about your day, think about the connections between your own health and the health of your community, and what small steps you can take to make a positive impact.
I love it.